Hello, why don't you go ahead and introduce yourself and then talk a little bit about what some of the things were that you were dealing with before you got under care at Perkins Family Wellness.
My name is Sarah Spahn, and prior to coming here, when I was 13, I was diagnosed with Ehlers-Danlos syndrome, which is a connective tissue disorder that causes hyper-elasticity and hyperextension of all of your ligaments, tendons, all of your connective tissue. So basically, I can dislocate most of my joints, which has led to a lot of other problems. I have multiple herniated discs in my lumbar, and I also have a lot of different pain in my neck and my back, and constant headaches, difficulty sleeping all the way through the night, pain, sometimes even simple tasks like around my house or being able to get ready. Prior to coming in, I actually wasn't even really able to walk very well because I had pinched a nerve, and I wasn't really able to sit or stand or do anything comfortably because my left side was in so much pain. So it was definitely a constant battle of trying to live with different types of pain pretty much throughout the last 15 years.
Wow.
Yeah.
And so you've been under care for about 7 months now. Why don't you share with us some of the results that you've seen in the last 7 months?
So prior to coming here, I was very reliant on pain medication like Norco, Advil, Aleve, things like that, and I would take them multiple times throughout the day just to get through, and sometimes it wouldn't even really help. It would just kind of dull the pain, and it probably even a few months in, I'm now not taking any medication for pain. The only thing I survive on is biofreeze and adjustments, and I'm able to sleep through the night. I'm able to be comfortable. I feel stronger, and I can tell the difference when I'm actually stable and how I'm supposed to be, sitting and standing and actually feeling like I'm in an upright position, which is nice. And I can walk a little bit better than I was before, which is definitely helpful. But the biggest thing has been the pain. A lot of the pain has severely decreased since then, and even just my mobility in general has been severely increased with just how I move and how I feel more comfortable. I feel more stable.
Yeah. And what would you say to someone who's contemplating getting under upper cervical care themselves?
I would definitely tell them to try it and to look into it. And I never knew anything about upper cervical care. I always thought that chiropractor was a bad thing for me, and then when I actually learned that there was something different type of chiropractic care that could help, it made a world of a difference. I can't imagine if I had never been here where I would be at this point.
Awesome. Thank you very much.